Hello, this is Dr. Nina Nguyen, geriatrician at SUNY Downstate. Today we're going to talk about primary care in our multimorbid older adult. By the end of this talk, you should have an understanding of the prevalence and complexity of multimorbidity in older adults, have reviewed assessment tools and frameworks for older adults, learn some person-centered approaches to care planning, recognize common clinical challenges, and have an understanding of evidence-based strategies when we are providing primary care for our multi-morbid adults. So let's get into some definitions. So we often hear comorbidity, which is an older term. It refers to a disease-focused approach where there's an index disease, and any resulting or concurrent issue that occurs in relation to that index disease is considered a comorbidity. For example, if someone has diabetes and as a result they have renal disease and hypertension that results, then those are considered comorbidities. Now, this is a common term, and some people use it interchangeably with multimorbidity. However, it does sort of give a bit more of a focus on the disease itself and also priority to maybe the first disease that has occurred in a patient. Multimorbidity, on the other hand, has a bit of a broader definition and is a bit more patient-centered. It refers to any co-occurrence of medical conditions within a person. So it doesn't really give any priority to one condition, and it allows you to have this perception of the patient as a whole. Now, as we have a growing aging population, we know our older adults are more likely to have multiple medical conditions, chronic medical conditions. So in the United States, the prevalence of multimorbidity in adults 65 years old plus is anywhere from 60 to 80%. With increasing conditions in a single patient, there is an association with increased hospitalizations, increased mortality, overall decreased quality of life, especially when we're talking about function and mobility. And as a result of all of this, an increase in healthcare costs. So when we are providing primary care in our older adults that have multimorbidity, we want to keep in mind the goals of geriatric care, making sure that it's patient-centered, that we keep in mind what their goals are and what they want and what matters to them is kept sort of in mind, making sure that we focus on function over just disease management. Providing shared decision making between specialties as well as with the patient and their caregivers. Minimizing harm, making sure that we are not just prescribing for short-term goals or results, making sure we are streamlining them and optimizing, avoiding redundancies and things that may actually be unnecessary for them. Due to the complexity of patients with multimorbidity, a team-based approach is ideal. It may be difficult due to resources, but patients do much better when we have teams to support different aspects of their care. The American Geriatric Society has some guiding principles in approaches to our multimorbid older adults in primary care settings. There is a focus on eliciting what is important to the patient, what matters, the priorities. We want to make sure we are treating a patient in accordance to what they want, making sure that we have an understanding and they have an understanding of both the benefit or the harm in all treatments that are provided. Taking into account things like life expectancy and prognosis before moving forward into therapies or treatments that may provide short-term benefit without an overall benefit to the patient. We always encourage shared decision-making and coordinating care with other specialists and whoever is involved in the care. And there is a lot to be said about deprescribing and removing redundancies or things that are not necessary. Oftentimes, this is not something at the forefront of a provider's mind. We are sort of trained to treat, and deprescribing may often feel like taking away. However, in the case of an adult that has multimorbidity and a lot of complex issues, being the person that can sort of streamline things and remove things that otherwise might be causing harm can create a lot of benefit for the patient. The National Institute of Healthcare and Excellence in the UK have guidelines that are similar. And there is, again, a focus on individualized care plans, making sure that we are prioritizing conditions that affect quality of life, minimizing treatment burdens, again, that idea of deprescribing, using non-pharmacological strategies, and coordinating care across specialties, across, disciplines, to all the providers that may be involved in a patient's care. The Choosing Wisely campaign is a global initiative led by the ABIM Foundation, with the focus on encouraging and opening communication between patients and providers, with the goal of avoiding unnecessary treatments and tests and procedures, making sure that we keep goals of care in mind, and prioritizing function over just treatment for diseases. In the end, it aims to reduce medical waste and prevent harm from redundant care. Here we have the 4M's framework of age-friendly health systems. Oftentimes you'll also see 5M's, the fifth M being multi-complexity or multimorbidity, which is common in our geriatric patients. But these are things to keep in mind when we are providing care for our older adults. What matters to them? What is their goals of care? What are we going to focus on? What is their priorities? Medications, making sure medications are necessary. If there's multiple specialists, oftentimes there may be a lot of medications that are just continued because one person does not want to deprescribe it, or they're not sure, and there's so many cooks in the kitchen and there's not enough communication. Mentation, we want to prevent, we want to identify, we want to treat any changes that happen in cognition as well as mood, as we know it can largely impact our patients' quality of life. Mobility, screening for falls, and making sure our older adults are safe and stable in their ability to function in their environments. So these are all things that we have to keep in mind every visit that we have in primary care with our patients.